Female-founded Midi Health has officially joined the Unicorn Club. That's after a $100 million Series D funding round. Midi is a telehealth platform for women's health conditions that offers insurance-covered care in all 50 states. Joining me now is Joanna Strober. She's the co-founder and CEO of Midi Health. Joanna, welcome.
Thank you.
So congratulations on the funding round. How do you plan to allocate the capital to support the business?
So we're building a platform to support women's health nationally with all sorts of health concerns. So we started with perimenopause and menopause, then we added weight, now we're adding joint pain and anxiety and depression and really all the things that women are experiencing during their lifetimes. So we're using the money to both expand our technology platform and add more care concerns and then hire more providers.
And just to set the base layer, what service does Midi Health provide and why did you start it?
So there's a huge care gap in the market for women's health. There are not enough trained providers, there's not enough research, and there's just really a lack of care in this country. So we've started Midi to solve that care gap. And essentially what we offer is insurance-covered care where you actually talk to someone. It's not AI, it is actually a real conversation with a trained expert in women's health to make sure that women get access to the highest quality health care.
And you mentioned that when this platform first launched, you were focusing on perimenopause and menopause, and it has evolved since then to cover more women's health concerns. Can you talk about that evolution and why you decided to expand?
Yes, so women started sending their daughters and their mothers. Seriously, they started saying, wow, you've taken care of me. Thank you for helping me take care of my night sweats and my sleep and my anxiety. My daughter has menstrual migraines. Can you help her with that? Or my daughter is moving from city to city and doesn't have a provider. Can you help her with birth control? And then actually the same thing with older women who are in their 80s and looking for vaginal estrogen or having UTI challenges. So we've expanded basically in response to the demand.
All right, and what has the customer response been?
It's very exciting. I mean, essentially part of why we're raising this money is that we just can't keep up with the demand. There's so many women who are looking for high quality care. When you look at our country, half the counties don't even have an OBGYN. We have a massive shortage of primary care doctors. We have a massive shortage of specialists. So essentially Midi is able to fill this gap of care, of specialized expert women's health care. And there's a joke in the field of dreams, if you build it, they will come. Well, they are definitely coming. So we have a lot of demand, and it's exciting to have the capital to expand it.
And I understand that listening is a core value of Midi Health. Why is listening so important in women's health care?
You know, I think there's been so much stress on efficiency, but women often don't feel heard with regard to their healthcare challenges. They feel like doctors ignore them, they don't take their concerns seriously. And so a lot of what Midi does is train really good listeners. We train people to listen carefully to your concerns and then make sure that we're giving you the right targeted interventions to help you feel better.
All right, and why do you think that that's important? And how do, what's the feedback you get about that listening value?
You know, honestly, in the age of AI, and we're using a lot of AI in our system, but in the age of AI, I would say actually people don't feel heard even more. They feel like there's not enough people who listen to them, take their concerns seriously, and take their personal health history into consideration. And so what we're finding is by offering real conversations with real people, that is a real value to women.
And you mentioned using AI in your platform. What are the use cases for AI on the Midi Health platform?
So essentially, we're building a health system without walls, right? We have over 500 providers at this point all throughout the country. We're building a health system without walls. That means you use AI in every part of the system, using it for billing, using it for prior authorization, using it for chart review. We're using it for every part of the platform that we've built to enable a scalable platform. But importantly, we're not using it to actually provide the care. We have providers to actually do the care, but AI is supporting the rest of the journey to make it really high quality and efficient.
And how has Midi's care model impacted women's health outcomes?
So we're collecting data. It's actually really exciting. So we've had over 250,000 women as patients, and we see their data, their longitudinal data and their outcomes. So we're able to much better tailor the care to them based on the outcomes that we're seeing. Historically, there's never been a place with so much data where you can look at one drug versus another drug versus another drug. Each drug company does their own study, but we have a platform across all of them. So we're able to really get a good understanding of which women should be on SSRIs, which women should be on hormones, What happens if the people are using vaginal estrogen? What happens if they're using new medications that are coming out for menopause? And then we can compare those outcomes to previous outcomes and really prove that we're getting better women's health outcomes.
And why do you think it's so important to be so on top of data?
Data is key here. There's been such a lack of research in women's health. So I think historically, women have really been given the wrong care. There hasn't been enough information to understand what the right care is. So historically, women have just not gotten access to the right medications, the right supplements, the right lifestyle changes. But with the data that we're collecting, we can actually prove that things work and make sure that women get access to the right solutions.
All right, Joanna Strober, co-founder and CEO of Midi Health. Thank you for joining us at the New York Stock Exchange, and congratulations.
Thank you.